For the best medical and paramedical lectures, subscribe to our channel and press the bell icon to stay connected with us. Hello everyone, welcome back to NCLEX Preparation Part 17. We will start our today's lecture with 81st question. So here it is. The registered nurse is making assignment for the day. Which client should be assigned to the pregnant nurse? The nurse giving care is pregnant, so which kind of client should be assigned to her? So the options are the client with HIV, the client with a radium implant for cervical cancer, the client with RSV, respiratory syncytial virus, or the client with the cytomegalovirus. So which client should be assigned to the pregnant nurse? And it is answer A, the client with HIV. The pregnant nurse can care for the client with HIV if she uses the standard precautions. There is no harm to her. The client in answer B, C, and D pose at a risk because they are radium implant for cervical cancer, respiratory syncytial virus, and cytomegalo disease. So this client will affect the pregnant nurse. So they are incorrect answer. Now question number 82. The nurse is planning room assignment for the day. Which client should be assigned to the private room if only one is available? So the options are the client with the methicillin resistant staphylococcus aureus, MRSA, the client with diabetes, the client with pancreatitis, and the client with addiction disease. So which client should be assigned to the private room if only one nurse is available? So the client with methicillin resistant staphylococcus aureus, it is simply known as MRSA. So why it is? Because the client with MRSA is placed on a contact precautions. The client in answer B, C, and D pose no risk to themselves or other, so they can stay without the nurse or they can have the greater ratio of nurses. Moving on further, question number 83. The doctor accidentally cuts the bowel during the surgery. As a result of his action, the client develops an infection and suffers brain damage. The doctor can be charged with option A, negligence, option B, tort, option C, assault, or option D, malpractice. So which charge should the doctor will face? And it is malpractice, because the doctor could be charged with a malpractice, which is failing to perform or performing an act that causes harm to the client. So because our answer A, B, and C are incorrect because they apply to other wrongful act, not in this situation. Negligence is failing to perform a care for the client. A tort is wrongful act committed on the client or their belongings, and the assault is a violent physical or verbal attack. So as there is nothing like negligence, tort, or assault, the answer will be malpractice, and the doctor will charge with the malpractice. Moving on further, 84. Which assignment should not be performed by the nursing assistant? Answers are feeding the client, bathing the client, obtaining a stool, and administering a fluid enema. This is the most asked question with the student nurse that are tracking their practices, because they are doing lots of work, so they ask this type of question many times. So in here our answer will be administrating a fluid enema. A nursing assistant will never do that. Means they do not have to do that. They should not do this, because the nursing assistant should not be assigned to administer a fluid enema. This can be administer a soap or tap water enema. The other tasks can be performed by the nursing assistants, and those are feeding the client, bathing the client, or obtaining a stool. So answer A, B, C are incorrect. Moving on further, the mother calls the clinic to report that her newborn has a rash on his forehead and a face. Which action is more appropriate? A mother calls the clinic to report that her newborn has a rash on his forehead and a face. Read the question carefully. It's a newborn baby having a rash on his forehead and a face. So, which is the most appropriate action taken by the nurse at the time? It will be tell the mother to wash the face with soap and apply the powder. Tell her that the 30% of newborn have a rash that will go away by 1 month of life. Report the rash directly to the doctor immediately, or ask the mother if anyone else in family has the rash in the last 6 months. So which will be the most appropriate action? And it is tell her that the 30% of newborn have a rash and that will go away by 1 month of life, because the mother is most likely to describing a newborn rash. About 30% of all newborn have a rash on his face and forehead that disappears in approximately 1 month of life. ABC are the incorrect action because they do not match this criteria. As all the newborn have this problem, you should not have to report the doctor. Do not apply soap or on the face, or do not there is no need to take any kind of history from the patient or the mother. So I hope you all understand it. Thank you for being with us, and share with your friends. Till then, stay home, stay safe. Do like, leave a comment, and share with your friends.